Okay,
Okay.
so this is one that we've actually had in the queue for a while, and I've tried to research it and I've asked several different people. So if anyone in the chat knows the answer to this better than what I'm about to provide, please feel free to let us know. So Diana asked, I need help determining which HCPCS Level II code to use for 5 surgical team members meet with the patient to determine a treatment course. Would it be a G code? So this is what we found. So basically, I said this was a toughie, and all we could find were these two S codes, S0220 and S0221, Medical Conference by a physician with an interdisciplinary team of health professionals, and the difference was approximately 30 minutes versus approximately 60 minutes. Now, these are private payer codes. If you turn to the S section in your HCPCS Level II manual, it'll tell you that these are not payable by Medicare. So that's one caveat to even using these. And then it would really depend if the patient was an inpatient or not. I know back in the day when I used to be an occupational therapist on a rehab unit, we would have these interdisciplinary team meetings, but the patient was an inpatient. And so we were talking about, they're discharging them or transfer them to a different level of care, that sort of thing. So I was kind of getting the sense in reading this that the patient wasn't an inpatient. I mean, I guess I'm just inserting my own filling in the blanks here, that they were an outpatient coming in, getting, a consult, if you will, or, a meeting this way. But if they were an inpatient and they're private pay, then you could probably use these codes. And then I ended with the only other thing I would consider is if the above didn't work, like maybe they were Medicare, then you might want to consider that pre-meeting work is going to be bundled into the eventual surgery codes that they're going to be billing. You could also consider doing an outpatient E&M based on time, like the rule for coding based on time is if counseling or coordination of care dominates the session. So if it was documented that way, then perhaps you could go that route. So that's really all I had for that one. I don't know if we've got anyone jumping in the chats here.
I don't see anything.
Okay, then I don't feel so bad. So there you go. And that just goes to show that, not everyone knows all the answers. We really try, but, sometimes I think the answer is certain things aren't billable. They're going to be bundled.
Yeah,
And
and Camilla did have a point here. She put, I do physician billing for surgeons and orthopedics. They see something other than post-op. Let's see. She can append a 25 in addition to a 24 when procedure is done on the same day of the visit. Not related.
yeah, I mean, I'm assuming if there's 5 surgeons, this is going to
Yeah.
be a big, hairy deal surgery,
And Josh says G0175 might
G017.
be able to be used.
Let's see. All
What's
right.
that one?
Good old find a code. Let's see here.
Indus in Inder I can't say that. A team
Scheduled
conference.
interdisciplinary team conference, minimum of 3, exclusive of the patient care nursing
Mm.
staff with patient. That's a good possibility.
Yeah,
Okay,
that
I'll
looks
sign
good.
that up.
And you know what? Some of them may be payer specific. A payer may want it done a certain way versus another payer too. So that might be something to inquire, don't you think?
Mm-hmm. But that's probably the G code they were looking at.
Yeah.
All right, very good.
Yay, we got smart people on our webinars.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.